Εκ μέρους της εταιρείας Ζαφειρόπουλος, θα ήθελα να σας ευχαριστήσουμε για την προσέλευσή σας. Θα έχουμε την ευκαιρία σήμερα να ακούσουμε την παρουσίαση από τον Dr. Camille Lieners. Ο Dr. Lieners κατάγεται από το Λουξεμβούργο, έχει διδακτορικό στην μικροβιολογία και σπουδές χημείας και χημείας τροφίμων. Και η παρουσίαση που θα ακούσουμε, που θα δούμε, αφορά το IMUPRO Concept και ο τίτλος είναι The IMUPRO Concept, How an IgG Guided Food Elimination Diet Could Help to Manage Autoimmune Diseases. Θα ήθελα να ευχαριστήσω τους προέδρους της δορυφορικής διάλεξης, τον κύριο Παναγιώτη Σκένδρο και τον κύριο Πασχάλη Σιδερά, για τη συμμετοχή τους και θα καλέσω τον Dr. Lieners to join us and to hear his, I believe, exciting lecture. So, Dr. Lieners.
Thank you. So, good morning, everybody. Thank you for inviting me for this conference. Thank you, Mr. Chairman. So, I would like to share with you my experiences with the IMUPRO concept. And now, the IMUPRO concept aims mainly to find the cause of chronic diseases. So, medicine has made huge improves in acute medication or in surgery and all this kind of stuff. But in chronic illnesses, sorry, but modern medicine has not made much progress. So, and one of the reasons for this is that in chronic diseases, you mainly try to dampen the symptoms, but you hardly find the cause of these chronic diseases. So the IMUPRO concept aims to find the cause of chronic diseases. As it's not just a test, but a concept, it also accompanies the patient throughout the nutritional changes, because the main challenge in all this is that you need to change your habits. So we will tell you what food will be good for you and what food you should avoid. And by avoiding, meaning changing your habits, and that's not an easy task to do. But at the end, we aim to have a sustainable improvement of your health situation. Now, the IMUPRO concept consists, as the title already showed, on the measurement of IgG antibodies. Now, there's a huge controversy about IgG antibodies in the medical or in the scientific field, and particularly from allergologists. So one of their claims is that IgG is only an indicator for contact, or only indicates that a certain food has been eaten, and that IgG is a physiological reaction. So this is actually the knowledge of 30, 40 years ago. That was my first reaction when I got introduced into this topic, that, okay, but IgG, you know, from serology, it tells you that there was a contact, but no indication in time, no indication of pathology. But in food, this is completely different. So the claim, of course, of the allergologist in this case is wrong. And Dr. Rusch in Germany, from a big laboratory in Germany, she had the same concerns when we introduced this test to her laboratory. So what she did is she made a trial where she tested subjects, and whenever they were negative to milk, cow's milk, or eggs, or soy, she made a provocation with them. So what she did is that, so if you were, for example, negative to eggs, you had to add 2 additional eggs per day into your diet, or 3/4 of cow milk, or 3/4 of soy milk. And this over a period of 3 weeks. Then she repeated the IgG measurement, and then people went back to a normal food, so just to see if there is a delayed reaction as well. And after an additional 4 weeks, she repeated the IgG measurements. And as you can see on the right side, the green, this is reaction class 1, so that is the first positive class. And these are the measurements, so you can see that none of them have developed IgGs to that food that they consumed excessively. So the claim that it is a normal reaction to a food that you eat is wrong. So it is not a normal reaction that the immune system produces antibodies to every food that we eat. And these are data from our lab, so these reflect more than 10,000 patients. And so you can see that for pork, for example, and Luxembourg is a country where we eat a lot of pork, and a lot of meat, only 2% reacted positive, only 4% to beef, 3% to rice, 5% to potatoes, 13 to oranges, salad 3, chicken, and so on. So you can see that these are basic foods, and only a few percent of our patients have reacted to them. So it is not a normal reaction. Then they say that IgGs have no pathophysiological significance. Also, this is false. Why are IgG antibodies as the main markers or the main antibodies involved in autoimmune diseases? Why are more than 82 monoclonal antibody drugs approved by the FDA in cancer treatments if they have no implication? So, and the action of all these medications is immune-mediated tumor cell killing. So they induce phagocytosis, they activate the complement, and it's an antibody-dependent cell-mediated cytotoxicity. So IgG has an implication when it is present in blood. And they also say that there's no danger of IgG to the body. This is also false. So if you look at this publication, which is really, really groundbreaking, it has been done by high-rated departments, university departments in Paris, France, in Tokyo, and Netherlands, and they could show that with IgG receptors, antigens, and neutrophils, you can induce an anaphylactic shock. So this is a highly interesting paper, and they showed that neither IgE, histamine, mast cells, basophils were involved, and that the main pro-inflammatory marker was the PAF, the platelet activating factor, and it was mainly neutrophils that were implicated in this. Now, of course, in that case, the antigen was injected, food is ingested, so you won't have an anaphylactic shock due to the degradation of the antigen, due to the passage through the gut barrier. There's a dilution, so the symptoms are not anaphylactic, but they are chronic inflammatory and they are delayed. And this brings us to the other problem with allergologists is the type of antibody that you look at. Now, for the allergologist, the main antibody, when an allergologist talks about IgG, they are talking about IgG4, because IgG4 is the antidote to IgE. So when you make a desensitization, you try to boost IgG4. Now, when you look at the properties of IgG4 compared to the other subclasses, IgG4 cannot neutralize, of course, but cannot opsonate and not activate the complement. So in this case, IgG4 is not able to do that. And these are two prerequisites for an inflammatory reaction. While IgG3, 2 and 1 are strong opsonizing and complement activating factors. So IgG4 is indeed the wrong antibody. IgG4 is an anti-inflammatory antibody, while IgG1, 2, and 3 are pro-inflammatory antibodies. And when I was in university, there was Th1 and there was Th2 reactions. Now we know that we have additional Th reactions, and one of them is Th17. Now, when you look at, in the old classification, we have the Th1, normally cellular immunity in the past associated to autoimmunity, and we have Th2, which are antibody humoral immunity in the past attributed to allergies. Now, interestingly, when it's Th2, you have IgG4 as the antibody which is produced, while if it's Th17, you have the other pro-inflammatory antibodies that are produced. And nowadays in autoimmunity, we talk about Th1 coupled to Th17. So there's a paradigm shift with the Th17, means that these are native T cells which differentiate after contact with the antigen. So with different cytokines which are involved, and one of the most important characteristics is that they have a chemotactic effect. So it means that they attract phagocytes to the site of inflammation. And the main target cells are granulocyte monocytes, but not eosinophils, and they act in concert with TNF-alpha and AL1, which comes from Th1. And the main characteristic is that they boost the antibody production from B cells, mainly pro-inflammatory IgGs. So So again, the balance between Th17 and T regulative cells, or Th3, will determine if we are healthy or not. So if we have an overgrowth of Th17, we are more prone for autoimmune diseases, for pro-inflammatory diseases. If we have contrary if the balance goes the other way to the Tregs, then particularly if it's a long term, then we are more at risk of developing a cancer because the immune system will not attack the cancer. So again, defense or tolerance, it all depends on the balance of the Th17 and Tregs. So Tregs, for example, they are extremely important for self-tolerance, by the production of IL-10, and in case of food also of TGF-beta, and therefore for oral tolerance. Now, when we look at the what is happening when we eat something or when we have an antigen, so first of all, we have to differentiate between the two compartments, between intestinal mucosa and the peripheral tissue. So when we have the antigen, it will be taken up by the MHC 1 and 2 and presented with the antigen-presenting cells. And at that moment, the immune system will decide if there is a response or not. So the normal response for food is, of course, tolerance by the release of TGF-beta. And this mainly happens if you have an anti-inflammatory environment in your gut. And the anti-inflammatory environment of your gut also depends a lot of your gut flora, so of the microbiota present in the gut. Then, if you have more Th2 compared to Treg or T17, you will, and particularly if you have a genetic predisposition on IL-4, so polymorphism on IL-4, you will produce IgE. If you don't have that polymorphism, and if you have the release of IL-10, it will lead to the IgG4. And if you have a pro-inflammatory environment, so then it will lead to TNF-alpha, IL-17, 6, 23, and 12, and will lead to the pro-inflammatory IgG1, 2, and 3. In the first case, we have a classic allergy reaction, so degranulation of mastocytes, release of histamine, which is a type 1 allergy, which is symptomatic. In the second case, we have IgG4, so we have the fixation of the allergen. It will be transported to the liver and will be degraded by macrophages. In that case, sorry, we're still in front of a type 1 allergy, but asymptomatic. While in the third event, we have the activation of the complement, phagocytosis by neutrophils, and then we talk about allergy type 3 according to the Bell-Coombs classification, and that means that we have an inflammation, and as this is on a low grade, it probably will become chronic because you don't identify the triggering foods in that case. So again, what is the property of IgGs? IgGs recognize the intruder, so the aggressor. It will fix it, it will neutralize it, it will form circulating immune complexes, and by doing that, it will also opsonize them, meaning make them visible to the immune cells, because the antibody itself and the antigen are not visible to the immune cells. It's only when they are opsonized by except for the innate immune response, but for the humoral immune response, the immune cells will not attack an antigen when it is not fixed to the complement or to an antibody. So we have the activation of the complement, we have the attraction of granulocytes, and the destruction of the immune complex. So in case of infectious diseases, of course, this is a protection against the aggressor. So this protects us. That's what we do when we vaccinate. So then we have a protection. But in case of food, it will lead to chronic inflammation, because what we call protection against a virus or a bacteria is nothing else than an inflammatory response to that particular aggressor and the destruction of it. But if you have, as a physician, if you are vaccinated against hepatitis B, well, that's very fine, so you're protected, but how often do you encounter this hepatitis B? Maybe not even once in your career. But if you have the same antibody to a food, let's say yeast or gluten or whatever, and you eat this on a regular basis, you have the same reaction every day. So, and when you have, for example, when you become sick, 1 or 2 days before the real symptoms appear, you feel down, you feel tired. So that's sickness behavior. We call that sickness behavior. So you don't feel good, you're a little bit But that is already an immune reaction that's taking part. So, and that takes part as well when you eat food. So that's why a lot of people are tired, are depressed, are not don't have physical power, and so on and so on. So it's exactly the same process. In infectious diseases, it's spontaneous, and in food, it becomes chronic. So how does this happen? So of course, the intestinal permeability, or if you can like it, you can also call it leaky gut, plays an essential role, because that is the physical barrier that is responsible of retaining aggressors and toxins and also undigested food proteins. So normally the food will pass through the cells. In hyperpermeability, it passes by the cells. So it will reach the immune system in an, let's say, unflagged way, and the immune system will react and will form circulating immune complexes. Normally, these immune complexes are destroyed in circulation. So that means that normally you don't really realize that this happens, except that you may gain weight, that you may have iron deficiency, that you may have other systemic problems that can occur, but no specific problems. But if these circulating antibodies are complexes adhere to sensitized tissue, this could be the thyroid gland, this can be a joint, this can be in your head, this can be actually any tissue, then you will have a local destruction of the immune complex. And this local destruction of the immune complex will also then, because it's an overwhelming reaction, it will also damage the surrounding tissue. And then it will lead to specific symptoms. And these specific symptoms, sometimes they have a genetic predisposition because special tissues may be sensitized, it may be by trauma or others. Now, in practice, it's quite difficult to, because symptoms may overlap. So if you have headache, it might be that you have a histamine intolerance, it might be that you have an allergy, it might be that you have a type 3 allergy. So for a physician, sometimes to choose the right diagnostic tool is not evident. So, and the best thing is to question your patient and ask when do the symptoms appear. So if they appear within seconds or not later than 30 minutes, it's very likely to be a type 1 allergy that occurs, because then we are in more or less in an acute or immediate reaction. When the symptoms appear between 30 minutes and 2 hours, and mainly if the symptoms are intestinal problems, then it is very likely to be an enzyme deficiency, either lactose, fructose, or histamine. And if the symptoms are delayed, let's say from not 3 a.m., but from 3 hours to up to 3 days after you eat a certain food, and or if you cannot really point to the point, and that particularly you have chronic diseases, then it is very likely to be an IgG-mediated reaction. And these are mostly all the indications that we have. So you almost find every chronic pro-inflammatory disorder that can be affected. I will go a bit fast, otherwise I will be late in time. So, but this is about what it is. Now, what is the relation, the link to the autoimmune diseases? Now, autoimmune diseases, the definition is that the immune system attacks the own body tissues. Now, I would really question if that really is so, because if you look at this slide, you have to question it. Now, for example, in Hashimoto we have anti-TPO. In lupus we have anti-DNA, histones, ribosomes. In Sjögren's also antibodies. And P anchors and C anchors in that one. So the problem is that all these antigens actually, or these targets, they are intracellular. Now the antibody cannot penetrate into the cell. The antibody reacts to surface antigens, not to intracellular antigens. So how could it be that if we have an anti-TPO, that it will destroy the thyroid gland? It's actually not possible. So this is why I question, is it really so that these IgG antibodies that we test in autoimmune diseases, if they are the cause of the illness or are they the result of the illness? And I think they are just the result, they are a marker of the illness, but they are not the cause of the illness. The cause of the illness is somewhere else. And the cause of the illness, we have two possibilities. Either we talk about antigen mimicry. So this means that, for example, food, but it's not only food, but in this particular case, we only talk about food, that these foods, for example, milk and wheat, they have similar, their epitopes are very similar to also to human molecules, like myelin oligodendrocyte glycoprotein, like human islet cell tissue, like human acroporin. That means that if you have an antibody against gluten or dairy, that this antibody may also recognize these epitopes on the human cell, adhere to them, and react to them. Now, these ones are, for example, surface proteins. So in that case, we have a direct aggression of an antibody previously directed against the food, attacking human tissue. On the other side, we need an active destruction of the cell integrity. That means that there must be an active liberation of intracellular molecules like anti-TPO. And this can be done, for example, if you have a sensitization of the thyroid gland. Nobody knows why. It could be an infection, it could be anything else, which is then sensitized, and this immune complex is fixed to your thyroid gland or fixed to your joints, and then will be destroyed constantly. And this destruction will then liberate constantly the TPO, for example, or other mediators. And then the immune system, of course, reacts against the TPOs because it was sensitized to it, and then you have high levels of TPO. So this is, these are the two main theories that we can address when we're talking about the link between food and autoimmune diseases. Now, if you look at gluten, for example, and Vojdený has made very nice work in this, showing cross-reactions between gliadin and different foods and tissue antibodies. So if you look at these cross-reactions against different food, you can see that gluten is reacting against different, almost all proteins of the milk, against yeast, against oats, corn, millet, even instant coffee, and then rice. Now, the reason why they did it, this trial was because there were celiac patients complaining that they still are celiac and still have symptoms, but avoiding gluten 100%. So was it cross-contamination, was it cross-reaction, or was it a wrong diet? Now, in this case, we could see that there might be some cross-reactions to other foods. But even more interesting is when you look at the cross-reactivity between gliadin antibodies and tissue antigens. Well, I won't go through all of this, but you see it is huge. And this is also one of the reasons why celiac patients always develop other autoimmune diseases together with celiac disease. Not all of them will develop the same. Then again, it depends on the genetic predisposition. So HLA system is definitely very important, but a lot of autoimmune diseases share the same DR HLA patterns. So, and here you can see that, for example, a lot. So, for example, this GUT64, we just recently got a very, very nicely documented case of a juvenile diabetes type 1, which was completely reverted by applying our diet. Hashimoto it works in almost every case. Now, nowadays they say, well, TPO is not related to the disease severity. That's true. Why? Because the main problem of let's say are the hormones. Now in this case we have a fresh diagnosed Hashimoto patient in September 16. She had still a high TSH of 5.69. TPO was already elevated and anti-TG as well. Her complaints were fatigue, hair loss, brittle hair, skin problems, and so on and so on. Now then the treatment was changed to another drug, and in October you can see it has an effect. So the TSH was normal, but anti-TPO was still rising and anti-TG as well, and more importantly, the symptoms were still there. So and that means that the aggression is still there. So the aggression is still there because the antibody titers went up, and these different other problems in the body, they were not necessarily due to the thyroid problem, but to additional cross reactions or additional reactions on other body tissues. In November, she made the IMUPRO test. and applied the diet. So symptoms disappeared almost in a week. So that was very, very interesting. Her TSH, you can see over 1 year, was almost unchanged. But interestingly, in February already we have a decline of anti-TPO. TG was a little bit tailing, but in April it was down to complete normal values, and of course there was no symptoms left anymore. So, and this shows you that at this point there was no aggression to the thyroid gland anymore, and that's why no anti-TPO was released to the immune system, to the bloodstream, and the immune reaction stopped. And by doing this over a period of 7 months, which is a normal elimination of IgGs, also the IgG level decreased. On the other side, we have a patient that was known for about 15 years, suffering from Hashimoto, and in that case, the endocrinologist was quite happy because the TSH was 0.55. And that is the only criteria for an endocrinologist, is the TSH value. So if that is okay, that means the treatment is fine and the patient has no problem. But look at the TPO. The anti-TPO was 2,509. And she had problems. She had digestive problems. She had migraine. She had fatigue, stiffness. So she couldn't cross the legs while she was sitting. And she already had 100 milligram levothyrox. So this patient was not healthy. She was not well treated. Now, after changing the diet to the IMUPRO test, immediately the symptoms disappeared. So, and after about 6 or 8 months, when we looked again, well, the TSH was even lower. And look at this, almost 90% of the antibodies disappeared. So again, that means that in that case, the aggression to the thyroid gland has stopped and no TPO was released anymore and the immune system didn't react anymore. Well, IBD, IBS, IBD, we have a lot of publications showing that we have huge success in this topic. So the one in bold are all done with our publications which were done with our reagents, but there are also other publications showing the same effect. Another interesting case is eczema. Now, eczema is normally thought that it is IgE mediated, but it's only 20% of the eczema which is IgE mediated. There are cases, of course, which are mediated, but not all of them. And unfortunately, with dermatologists, the only option they have is then cortisone. And cortisone is not always the best option in babies. So, and there was a very interesting publication in 2013 by a Chinese university in Hong Kong, who states that all immunoglobulins are important, IgE, IgA, and IgG, and also all cellular components and complement are important in eczema and should be taken into care when you try to treat them. Now, this is a baby that was treated with IMUPRO. So this was the baby in 2007. In his worst case, of course, the pediatric doctor wanted to prescribe cortisone, but the woman, she was a bit more alternative and she refused the cortisone. And then she went on a more homeopathic treatment, and because she was breastfeeding and already was thinking about food, she avoided eggs herself. There was an improvement, as you can see, but unfortunately it was not sustainable, so there was a relapse. In August, then she did the IMUPRO for the baby and herself, and by applying the diet, there was a strong improvement. By mid-September, there was almost everything gone, and I got these slides in April, and between October and April, there was no relapse at all while maintaining the diet. This is the case from Dubai. Now, this child, she started having this kind of problems after 7 months. So when she started to be weaned off and had normal food, and at the age of 2, she came to Dr. Mulham, who was a pediatric ENT and allergologist. And until then, she had various treatments of creams, of cortisone, antihistamines, and so on, but no sustainable improvement. And when you look at what she ate before having the IMUPRO done, it was mainly cornflakes, dairy products, eggs, dates, wheat, chicken, meat, and fish. And then she made the test, and we had gluten, eggs, dairy products, hazelnut, onions, and so on. So, of course, only what you eat will also make you sick at the end. So there were excessive IgE tests done, they were all negative, and as she was positive to gluten, also celiac disease tests were performed, and she was also negative to this. So this was a non-celiac gluten sensitivity at the end, together with the other ones. But anyway, after changing the diet, you can see the baby, the child now. She's absolutely perfect and is enjoying life. And this poor guy is a guy from New Zealand, and he was suffering from extreme eczema and particularly itchiness. So he scrubbed himself as much as he was bleeding all the time, particularly on the arms. And sometimes he had just his hand rolled in bandage so that he could not scratch himself. There was no sleep for the family, and so on and so on. And of course, due to this scratching, he had infections like this, Staphylococcus, for example. So it was a real nightmare. Well, they performed the IMUPRO test, and after a few days and weeks, he had improved day by day. It all disappeared. And the only problem and then after, at the age of 5, it was the first time that he could wear some shorts. And we're still in contact with the mother, who has also 2 other children who have problems. They performed the test now as well and also improved. The only problem with him is when he goes to school and when he takes food from his friends. So then in the evening he comes back and he scratches again. So that really shows you the impact of food in this kind of disease. Migraine is another topic where we have huge success. So again, here we have 3 publications done with our tests, and based on these now even recommendations from diet societies say that you should do an individual test and an individual guided nutritional change in case of migraine. Also fibromyalgia, we have, this is a thesis, a doctor thesis from Germany, also showing huge successes in fibromyalgia patients. Obesity, overweight, hypertension in juveniles also correlate strongly to the presence of IgG to food, and particularly the systolic blood pressure is strongly correlated to this, and the thickness of the intima media, so which is a clear sign of inflammation of the blood vessels, correlate with the presence of IgG to food. Another even more interesting topic is depression. So these are data from our lab in Luxembourg and from 2003. So we made a survey. That was an observation study, and when getting these results, I was quite stunned, and I didn't believe them, so I recalculated them several times. So almost 40% of depression could be completely resolved just by applying an IgG guided diet, and about 55% told us that they had an improvement. So that makes an overall of almost 94%, which is exactly the same that we find in IBS. And IBS and the gut-brain link is very closely related. 0 to 9 metabolism takes place up to 88% in the gut, not in the brain. So that is the link. And then I went into the literature and I found that Mace and all, for example, in 2004, they published that depression is an inflammatory disease, and that most antidepressive drugs actually have an anti-inflammatory action. So, and they also they could replicate this in horses. So horses are also sometimes depressed, particularly racehorses, and then a racehorse which is depressed will never win. So what they found in the liquor, they found an increase of these pro-inflammatory cytokines, which have an immediate action on the HPA axis and release an enzyme which is called indolamine 2,3-dioxygenase. And this enzyme converts tryptophan into kynurenine, which is a neurotoxic compound, and it prevents tryptophan to being converted into 0 to 9. So if you have no 0 to 9, you will feel depressed. And even in that case, 0 to 9 uptake inhibitors will not work because there is not enough 0 to 9 present. If you have no serotonin, you will also not develop melatonin, and if you don't have melatonin, you have sleep disorders. And this will gives you a vicious circle where these people have very strong difficulties to get out. Now, a very new publication from this year, from 2019, from a Chinese group, which also used our reagents, they could show that, well, the main target was migraine and IBS, but they also measured serotonin in the serum. And they could see in the group using the IMUPRO diet that there was a huge increase in serotonin. So that explains why we have also such a nice success in depression, because we cut down inflammation and we reestablish normal serotonin levels in the blood. So that's a very good finding. So these are the main so I think that if you have depression, you should always address inflammation. And I never say that food is the only trigger. There might be other triggers as well, but we eat every day and we eat almost the same food every day or throughout the week. So it might be that food has a very strong implication, and it should something that should be addressed in chronic diseases. Now, the IMUPRO concept itself, it is based on 3 phases. So, of course, one is the test, and then we have an elimination phase where we look, where we aim to have an improvement of the symptoms. And if we have an improvement of the symptoms, means that indeed the food is implicated. Then this phase is about 5 to 8 weeks. That can be decided by the physician or by the patient itself, depending on the schedule they have. Then we do a provocation test, because we also know that not every positive IgG will lead to specific symptoms. There might be some false positive in the way that, for example, if you have a cross-reaction to a non-food, let's say a pollen or a virus or whatever, that there you have the native protein, where the antibody is directed to, but it can be that when the food is digested, that this particular antigen will disappear or will be degraded. So we still find the IgG because it was to the native epitope, but it's not present anymore when it is digested. So that's why some of these are not false positive, but they are just not, they're in vitro results, like every blood test is an in vitro result and not an in vivo. So therefore we apply the provocation test, and then we can see which food causes also which symptom, because not every food is responsible for the same symptoms. So I had mainly, let's say, 4 to 5, 6 main symptoms, but they were all caused by a different food at the end. So, and then it's interesting, it's an education process, and it also then eases the long-term elimination diet, because if you have a no-responding food, you don't need to avoid it permanently. And after this identification of your triggers, you then go into a stabilization phase for about at least 1 year, where you avoid your trigger foods. And another important factor or component of the concept is the rotation. That means that you don't eat the same food every day. So you rotate your food. So in that way, you avoid all kinds of deficiencies, because when you eat every day French fries, well, you will run into a deficiency probably. But when you change your food every day, and this on a 4-day cycle, you will always have enough macro and micronutrients. Now, this is how the result will look like. So in this case, we have the large test with 267 or even 270 with the Candida foods. So the green means non-elevated. That means that no or less than 7.5 microgram per milliliter IgG was detected, elevated and highly elevated. And we also look at IgGs for Candida, because positivity to Candida could be an indicator of a colonization of the colon, the long-term colonization of the colon with Candida leading to leaky gut. So in that case, that doesn't mean that you should take antimycotic drugs, but you should go for a colon test or a clinical test and see if you have any local infections of Candida or if it is present in stool. Now, the elimination phase is strict, so you should consider high elevated and very high elevated IgGs in the same manner. So it's not that if there's a few antibodies positive that this food should be eaten. No, you should cut it out. And this for 5 to 8 weeks. This is in line with our studies, so we know that most symptoms will improve after 1 week, some after 3 weeks. And only very, very severe diseases like MS or Parkinson will take months. They will improve, but they will take much, much longer. But 90% of all the symptoms that are correlated or related to food will improve within this period. So, and at that particular point, your body senses are most sensitive because the antibodies are still there. But now you feel how you can feel when you feel good. So, and if you feel good, and then you make the provocation test and you feel bad the next day, you will feel it even more stronger than previously, because previously you were more or less accustomed to it. Now, the provocation goes in the way that you eat one food per day, only one food, you introduce one food per day, and as pure as possible. So if you have, for example, yeast, baker's yeast, well, you don't eat bread, or you don't, but you take either dried yeast or a cube of yeast and you eat that. And if you have a reaction to gluten, well, you don't eat a pasta because there are other ingredients, but you can buy seitan, for example, which is purified gluten, and then you eat that. And you eat enough during the day, and then you check your body weight and you observe your symptoms for 3 days. The body weight is very important, very interesting, because it's the cheapest manner to see if you have an inflammatory reaction or not, because on every inflammatory reaction, you will have a retention of water. And this will lead, in this case, will lead up to 2 kilograms of retention of water. This is also in the first 3 days when you do the test. When you change your diet, you don't reduce the calories, but you just avoid the pro-inflammatory foods. After 2 to 3 days, you will lose 2 kilograms. Even if you're the skinniest. If you have that problem, you will lose 2 kilograms. That is because there's a release of water. And that's also one of the reasons why nutritionists, when you go on a diet to lose weight, they tell you don't weigh yourself every day because you will have these oscillations. Well, these oscillations are due to IgG reactions to food. So it's a very cheap and good possibility to see if it's a systemic trigger, or then the body weight is important, and if it is a specific symptom, then of course you observe the symptoms for 3 days. So the whole time needed for such a provocation for one food is 4 days. Now, if you have a lot of reactions, of course, it is difficult. But in practice, what you do is you start with the food that are your preferred food, because that is what the patient is interested in. You start with the preferred food, and we can pretty sure that most of them are also triggers. So either an increase in weight or symptoms, that means that you have to eliminate this food at least for 1 year. If there's no increase in body weight or no symptoms reappeared, then this food is allowed in strict rotation. Now, in phase 3 then is the stabilization phase, aiming to have a sustained well-being. So during that period, you will eliminate almost all your IgGs that were previously positive. You improve your health, and after 1 year, a vast majority of the food may be tolerated again if you eat them in rotation. If you want to be cured, you have to avoid them at least 2 years, because you still have memory cells, and these memory cells keep your immune memory. And when you trigger them too early, they will produce again antibodies. And if you introduce, let's say you're reacting to cow's milk, you avoid it for 1 year, all your symptoms that disappear, and then you start drinking milk every day, or having an ice cream every day, or I don't know, a cheese every day, then within a month's time you will have positive IgGs again due to the presence of memory cells. And these memory cells, according to the literature, have more or less a lifespan of 2 years, the B memory cells. So if you can get rid of them, then you're indeed cured for this, and you can reintroduce the food again. So these are the panels that we offer. We have a vegetarian panel, so for vegetarians, we have 90 foods that can be tested. We have the IMUPRO screen with 44 foods, the basic with 90 foods, and the 270, which is the IMUPRO complete, which of course is the best you can do, because we do not only identify your trigger foods, but also the foods that are safe for you. So you can build up a very reliable diet based on that. Now, in practice, which are the patients you can select? Well, of course, you have gastrointestinal problems, you have this metabolic syndrome, overweight problem, you have migraine, asthma. Asthma is responding extremely well to it. Hormonal diseases like Hashimoto, for example. Diabetes is a very, very good one, because what I forgot to say is that TNF-alpha is blocking insulin receptors, and TNF-alpha, and by blocking insulin receptors, you will induce a resistance to insulin. And on the long term, this will lead to diabetes type 2, but also diabetes type 1, particularly in juveniles, when it is very early diagnosed. IMUPRO is extremely helpful. When your pancreas is destroyed, it will not improve much, but early diagnosis, early change of diet will help. It is used in preventive medicine, chronic pain, like in fibromyalgia, infertility, very, very interesting topic, all kinds of autoimmune diseases, not only Hashimoto, and nowadays also in sports medicine it is widely used. So the patient should, who is good for this kind of test, is a patient with chronic diseases for whom no reason could be found. So sometimes you find a reason, but if you don't find the reason, think about food. Also, if previous treatments according to guidelines haven't been successful, so these are actually the criteria for the patient, for the selection of the patient, but then the patient needs to understand what is going on, because it is not a tablet that he's taking, but he has to change his habits, his life, his nutrition. So, and changing habits is the most challenging for everybody. It was also for me, to be honest, and, but I managed to do it, and I had all the benefit. And so the patient should also be able to follow our recommendation. And finally, last but not least, you have to look at the financial means that the patient have. So there's no reason to force him to take a large panel if he can only afford a 90 panel. So the 90 panel is also very good, and we have some soft skills which you can add to have a good result also with only 90 foods. So choose the right panel according to the financial means, and also the symptoms that you have. And by doing that, you will live a healthier life, because it works, it's accurate, and it's individual. So it's really one of the key things to a personalized medicine. Thank you very much. If you have any questions, feel free.
Dr. Lieners, thank you very much indeed for your interesting and, I can say, also challenging talk.
Yes.
About this concept. And
provocative is the right word.
Yes, yes.
I was aware that I told you it would be tough for you to listen to it, but it's. I mean, I have now 20 years experience with this, and I'm a lab pathologist. So I had the biggest laboratory in Luxembourg, and when I got introduced to this concept, I was extremely skeptic, to be honest. And but I never say no straight away, so I said, okay, give it a try. And so I tried it on myself, and I had never 1 hour of work. But I had my problems, right? I had problems in my chest, like heart attack. I had migraine. I was always in a bad mood. I didn't feel comfortable. So and I was always overweight. So I was still struggling with my weight, but I was even much more overweight at the time. So, and at the time it was just indicated to lose weight. So that's why I did it. And I realized after 3-4 days that I woke up as like a newborn. I had physical force. Everything was just fine. I got up at 6 o'clock to wash my car. Normally I got up at 8:30, and I was tired. And then after 3 weeks, I realized, well, this chest pain has gone. And I was in the cardiology department and so on and so on. And at the end they say, well, it's stress. No, it wasn't stress, because I wasn't stressed, and I loved my work. And that was yeast. That was yeast. After the provocation test, I could identify that was yeast doing this. Dairy was the one that made me tired and in a bad mood, and all the other ones make me obese. So I lost 18 kilograms within 3 weeks, eating more French fries. I just didn't say that French fries is good, but I ate more French fries because than the 3 years before in these 3 months, and I lost 18 kilograms. So it was not a question of calories, because I've eaten even more calories than before, because before I always restricted calories, but I eat cheese, milk, bread, and so on, everything which actually was counterproductive. And after a few years, I made an excessive exercise, for example, so I had tendinitis in both arms. This tendinitis didn't go away for more than 2 years. I tried everything, even strong medication, it didn't go away. Then a competitor came into our lab, just this, then I finished.
Yes, it's your personal clinical trial, actually.
Yeah, so I convinced myself. And Dr. Mulham, for example, Dr. Mουσείο, so the one I showed you. Dr. Mulham from Dubai, he earned his money by doing surgery on children, on nose, ears, and throat. He came to the presentation like this, not because he was interested because it was good food and the location was interesting in Dubai. So that's why he came. And after well, that was a different presentation, he said, well, sir, you talked about me, because he had a rat, he was obese, sweating, had a lot of skin problems. He changed his diet, he recovered, and then he started doing it in his children. And after 2 years, he said that he reduced his surgical activity by 80%. 80%. Well, you think he's going running bankrupt because he's not earning anymore, but now the Middle East is coming to him to have the IMUPRO test done, because when you help a child, that would spread like a virus, and so all the children now come to him.
Okay. Do we have any questions from the audience? Yes, please.
Hi, very interesting. What do you think the gut microflora has to do with this? Do you think there is a place looking at the microbiome? We should be supplementing our patients with probiotics or prebiotics after.
Absolutely. So when I introduced this test to my lab, the next test I introduced was a functional stool flora test. So we developed that as well. And of course, that is, I mean, we have 2 kilograms of microbiota in our gut, and they have 10,000 times higher metabolic rate than a human or than a mammal. So when this is going out of balance, the whole body will suffer, for clear. So particularly if we have a pro-inflammatory environment in our gut. So actually, we are next in January we are starting a study on endometriosis, because we know that in endometriosis we have also very nice results, and also an improvement of infertility in that case. But as this study is planned to over 1 to 2 years, with a good management of these people, we also added microbiome testing with it, so that we can see that what we see like this, but that we can prove that we also change the microbiome by avoiding pro-inflammatory food and giving, improving Akkermansia, Faecalibacterium, Pausensia, and Rosabellia, and so also all these anti-inflammatory bacteria. But at the end, what we did is we did this kind of stool flora testing in the past, and we supplemented with probiotics and prebiotics, yes.
Okay. Can I ask also a provocative question? Very often in approaches like this one, first of all, I was intrigued, very interesting, the fact that some people say that I feel better, nobody can ignore, but one needs to sort of make sure. I kind of remember an interesting, similar example in the 90s, when you mentioned TGF-beta, when TGF-beta 3 was found to be very good for healing but not doing scar, a huge clinical trial from Genentech, I think, was conducted for ulcers that don't close in elderly people and so on. And the problem was that the results were fantastic. About 70 to 80% of the people got better, but that was the placebo. So just talking to them and changing the way that the nurses were approaching them and so on made them feel better, and then the wounds were healing. How do you exclude in studies like this one, when there are small groups of patients and so on, and you don't know a mechanism, and basically you look at sort of symptoms disappearing or appearing without having a sort of a mechanism behind that? How can you calculate the placebo percentage of these studies from the actual?
And this, of course, placebo effect may always be present, but in all these studies, they were on a crossover design. So that means that the patient, they were double-blinded and they were crossover. So the patients or the subjects didn't know in which group they were. So that means they were 6 to 8 weeks in the placebo group, let's say, so in the sham diet group, and the next 6 or 8 weeks they were in the real group, or vice versa. So they were randomly assigned, so they were on parallel. So they just knew that they had to change the diet at a certain point, but they never knew if it was the good one or the bad one. So and then, of course, when the symptoms reappear, well, then we can say that it's objective, and the other side. And well, we have another study which I didn't show you now, which was on sportsmen, for example, with the Swedish Olympic swimmer team, and there we looked at particular markers like lactate, VO2 maximum, so objective markers, and there we could really see a nice U form. So went down when they were in the real group, and they went up when they were in the other group. So that is the way we can challenge. Otherwise, with the small number, it wouldn't be possible. Yeah.
Okay. Well, I think we already are quite late. If unless there's an urgent, quick question, we will sort of close this very interesting discussion. Any urgent questions? No? Done. Thank you.
Okay, thank you very much.